Well, welcome to the 700 Club. Quote, we're very ready for this. These were President Trump's calming words to the American public last night, even as the coronavirus has now spread to every continent with more than 80,000 cases. So what is the president doing to make sure the U.S. is ready? Jenna Browder has that story from Washington.
As top officials line up inside the White House to talk about control and prevention, we learned about the first infected American not connected to travel abroad or another known case.
And the number one priority from our standpoint is the health and safety of the American people.
President Trump assembling his team behind him to project calm and tell the American people he's in charge and on the case.
We're very, very ready for this, for anything, whether it's going to be a breakout of larger proportions or whether or not we're at that very low level.
And in a surprise move, announcing Vice President Mike Pence to lead the U.S. response to the outbreak.
I look forward, Mr. President, to serving in this role, bringing together all the members of the Corona Task Force.
On Capitol Hill, the Secretary of Health and Human Services with this warning.
America's risk is low at the moment. That could change quickly.
The National Institutes of Health says that while a vaccine is in the works, it won't be available anytime soon.
We can't rely on a vaccine over the next several months to a year.
The best way to contain the spread is through public health measures. The CDC calling on states, businesses, and public entities to draw on its resources.
The team is brilliant. I spent a lot of time with the team over the last couple of weeks.
Trump says Congress wants to give more than $2.5 billion he's asking for. And at last night's news conference, also criticized Democrats for making it political.
And what he's doing is late, too late, anemic. Hopefully we can make up for the loss of time.
In California, the latest case could be the first not connected to travel abroad or another known case, a sign it could be traveling within the community. And at Los Angeles Airport, health officials disinfecting surfaces after a Korean Airlines flight attendant tested positive. Meanwhile, on Long Island, New York, more than 80 people are under self-quarantine after possible exposure. The virus has now spread to 47 countries and is on every continent except Antarctica. And for the first time, the number of new cases is higher outside of China than within. In Washington, Jenna Browder, CBN News.
Let's hope and pray we don't politicize the virus. Let's not use it as an attempt to whip the president. Let's not play politics. It's a health emergency that needs to have all Americans on board, but we certainly don't need, and what I want to tell you, it's not some plot that was conceived in the deep, dark secrets of China to bring an infection to the rest of the world. It's none of those things. It happens to be a virus that's gotten loose. I think the mishandling of wild animals and other in Wuhan started this stuff, but should not be politicized. And to say, well, the president's not doing enough and he's way behind. He's not behind. He's been on top of it, and we're all working together, so let's not politicize it. Now, health reporter Laurie Johnson is here to talk about the latest on the coronavirus and how to protect yourself. Hey, Laurie, what can you tell us about this new case in California?
Well, it's in the Sacramento area, and the main thing about this is we believe that this is the first case of community spread, which means we don't really know where this patient got the coronavirus. It doesn't appear that this patient got it from someone who had recently been to China or someone else who had been infected with it, although they're doing contact tracing, and they may get some answers in the future.
Well, Laurie, what should people do to prepare for this coronavirus outbreak?
Most important thing people can do, Pat, is to step up their own personal hygiene game. That means wash your hands lots of times during the day. Be really careful because we know that this spreads much like the flu through droplets from people when they sneeze and cough, which get into about a 6-foot radius of that person, but then also can fall onto hard surfaces like doorknobs and handrails, and the list goes on. So if you touch those hard surfaces, then touch food and and eat it, you might be exposing yourself. Also, be careful about touching your face if you've been touching these hard surfaces. So really keep those hands clean. Also, improve your immune system. Boost the immune system. We talk about this all the time. We know that our gut health is 80% tied to our immune system. So get lots of sleep and eat right. Also, you might want to prepare if you need to. If you become sick, it's a good idea to stay home and self-quarantine. So make sure you have plenty of groceries and your medications on hand in case you need to hunker down for a while.
We might add, when you're in a hotel, the remote control for your television is always loaded with germs, coronavirus or otherwise. So handle that with gloves.
Indeed.
Well, Laurie, who's most at risk now in America for this virus?
Well, Pat, as a mother, I take great consolation in the fact that this apparently is not infecting children. Believe it or not, they have analyzed the first 72,000 cases of this, and zero children under the age of 9 have died from this. Wonderful news, because kids are usually the ones who get the viruses, and just a tiny fraction of a percent of people under 20 even get this virus. So we're seeing that the deaths are mostly aged over age 70 or over, and most of the infections are mostly age 50 and over, and many of these people have what we call comorbidities, which means they have something else wrong with them, like a lung issue or a heart issue. So these are the people who are most at risk, and I would like to point out that 80% of the people who have this coronavirus, their symptoms are so mild they do not need hospitalization. Many people don't even know they have it. It's so mild in so many people.
Laurie, is it a myth or not that in hot weather the virus goes away or not?
That's what a lot of health experts are wondering, if this is what it's going to be like. Because as I told you on Monday, Pat, there are 7 different coronaviruses in human beings. 4 of them are part of the common cold. And these are very mild and very widespread and are seasonal. And then there are the 2 others, SARS and MERS, which are not very widespread at all and much deadlier. So health experts are wondering and hoping that this COVID-19 is more like the 4 that are more like the common cold, very widespread perhaps, but also more mild. And with this vaccine, we may see that this comes around every year, and a vaccine this time of year may be helpful. But as you said, a lot of folks are wondering if, like the flu, it's going to go away when the weather gets warmer. That's something to pray about.
Well, last question. Where are we with treatments for the ones that do have this infection?
Very hopeful there. We know that this wonderful antiviral drug called remdesivir is being tested on coronavirus patients in Nebraska, the ones who came back from the cruise ship, and it's showing great promise. It's an antiviral, and we should know the result. They're doing randomized trials right now, which means the results are going to be very scientific and very reliable, and we should know whether that antiviral drug is working within the next few weeks. Also, there's great promise about immunotherapy drugs. We know that immunotherapy is a burgeoning field within medical sciences, and it has shown wonderful efficacy regarding cancer treatments. And what immunotherapy drugs do is we give them to patients, and it boosts their own immune system and helps them fight the pathogen that's in their body.
Great work, Laurie. Thank you so much.
My pleasure.
Laurie Johnson, our excellent health reporter. Well, stay with us for the latest on the coronavirus, and we continue to provide updates right here on CBN News Channel and on cbnnews.com. Well, in other news, Bernie Sanders has been steamrolling the Democratic primaries, talking about his plans like Medicare for all and forgiving college debt. But Sanders is not talking about the astronomical cost behind these plans and who is going to pay for them. I wanted to find out about it, so I asked our staff to research the figures, and what they found will shock you. We're talking trillions upon trillions of dollars. Gary Lane brings us this alarming look at Bernie's budget-busting bills.
We are not only going to win here in Texas on Super Tuesday, we're going to beat Trump in November.
Bernie Sanders has good reason to be confident after primary wins in New Hampshire and Nevada. As the current frontrunner, he's become a target as opponents criticize his platform as incredibly expensive. At the top of the Sanders list, Medicare for all, with a price tag estimated at $34 trillion or more over 10 years. Not billions, literally trillions. Then there's Sanders' support of the Green New Deal, the plan to move America away from fossil fuels at a cost of more than $16 trillion over a decade. Not all Democrats are on board with his ideas.
I do not support Medicare for all.
But I profoundly disagree with his solution.
Sanders says Medicare for all will save the country money in the long run, but he acknowledges it will be expensive.
I can't rattle off to you every nickel and every dime, but we have accounted for it. You talked about Medicare for all. We have options out there that will pay for it.
And there's a lot to pay for. Sanders has several other proposals, too. In addition to Medicare for all and the Green New Deal, Sanders has a guaranteed housing plan he says will cost $2.5 trillion over 10 years. He'll spend $2.2 trillion to make college free and cancel all student debt. $1.5 trillion on universal child care and pre-kindergarten, plus $1.2 trillion for K-12 educational spending and higher salaries for public school teachers, and $1 trillion for infrastructure. Add it all up, and it comes to around $60 trillion in new spending. That would double the size of the government. Critics other than his opponents, such as conservative economist Stephen Moore, question whether some of Sanders' new spending programs, like Medicare for All, would actually work for the people they're supposed to help.
Medicare is running out of money. The worst thing you can do for seniors is then put millions and millions and potentially tens of millions more people on Medicare, because the whole system is going to collapse. And this is one of the reasons that polls show the two groups that are most opposed to Medicare for all are, number one, senior citizens who depend on Medicare, and number two, union members who already have very good private health care plans but would lose them under Medicare for all. Remember, under Medicare for all, it's not if you like your health care plan, you get to keep it. This is, we don't care if you like your health care plan. We're moving you into a new system, and that's what makes Americans very nervous.
One thing basically everyone agrees on: Sanders will need to raise and even create taxes to pay for them. And he has a long list of new taxes, from increasing the payroll tax paid by employees and businesses by 80%, repealing President Trump's tax cuts, a wealth tax, raising capital gains taxes on investments, plus cutting military spending, and far more. Moore says that would be bad for the country.
I think it's do severe damage to the U.S. economy to add all of this spending, all of these new regulations, and then tax rates that would go up to 50, 60, in some cases 70%. We haven't had tax rates like that since the Jimmy Carter years.
And economists on both sides of the political aisle argue that Sanders' new taxes would not even come close to paying for all his policies.
The math doesn't add up. If you take all the taxes, and there are many taxes under Bernie Sanders' plan, and you try to match them up with the cost of the spending, it still doesn't pay for it.
That means on top of all of his new extremely costly government programs, the Sanders plan would dramatically increase America's exploding $23 trillion national debt.
You could potentially see over the next 10 years a doubling or even tripling of the national debt.
Sanders' enormous spending plans haven't gotten much public attention yet, but that's likely to change as he wins more and more delegates in the race for the Democratic presidential nomination. Gary Lane, CBN News.
The millennials are saying, well, we like the idea we're going to have free college, we're going to have free health care, we're going to have our student debt taken away from us, we're going to have a Green New Deal. It's just going to be wonderful. Well, I tell you what, millennials, when your country is broke and there's no money for anything, then you're going to wish that you had been more fiscally prudent. But this is just insane. And yet they're flocking like lemmings to the Pied Piper who is leading them off the edge of a cliff. It's just insane. $60-some trillion. The U.S. economy now is running about $20 trillion a year. This is 3 times the GDP of the whole United States of America, this 10-year plan.
And nobody's really holding his feet to the fire on this. He says, well, I can't account for every nickel and dime.
Yeah, nickel and dime.
$60 trillion.
$60 trillion. It's just unbelievable. And yet people are flocking to support him. Well, I heard on the radio today something that AOC, you know, whatever, Cortez, is actually putting her child in a charter school because the schools aren't very good, and she's got to get in a better zip code. So I think she's moving to Westchester. And Sanders is now a billionaire because of the fees he's getting for the stuff he's doing. And, you know, he's not any longer a poor man. These are pretty rich guys, and he wants to soak it to everybody. It'll destroy us. Whew. Wow. Okay, well, you heard it. I wanted to tell you what the cost was. $60 trillion over 10 years.
Have your eyes be opened.
Please open them. Okay.